Welcome to What I'm Dying to Know, which is a podcast brought to you by Bethesda Healthcare Palliative Care Team. And so this is a space for open, honest conversation about palliative care. What actually is it? Who's it for? Why does it really matter? So we know palliative care can feel like a pretty confronting topic for many people, and it can be really scary. But it's not all about death. It's about living well right to the end of somebody's life, supporting patients and families with things like comfort, dignity, and choice. So in this series that we're doing, we'll be speaking with the people who actually deliver this care every single day, hopefully sharing some stories with you, some insights, and hopefully some practical advice. So we'll also be hearing from our Facebook community who got in touch with us to ask some big questions. I'm Sarah Day. I'm a staff development nurse at Bethesda Healthcare Palliative Care Team, and this is where I do my dream job, which is teach the next generation of nurses how to do palliative care. Something I love because I can talk about it forever. So I'm here today with Bruno Cordier, who's one of our fabulous advanced enrolled nurses with many years of palliative care experience and a huge team player. And he always shares his care and compassion, not only for our patients, but also for their families and for all of us as a team also. We've got Dr. Dorit Lesterhuis-Vasbinder, who is one of our fabulous consultants, who is quietly passionate and very caring about everybody that she sees out in the community and in our unit. So between us, we have a few decades of experience, and we are lucky enough to work together every single day in one of Western Australia's leading palliative care units. So welcome, Dorit. Welcome, Bruno.
Thanks, Sarah.
I'm so excited to have you here. So thank you for coming along.
It's good to be here.
In this episode, we really want to share with our listeners our experiences around dying. And so try our best to really get across the need to actually normalise this for people. So if we, as a team of people that feel really passionate about this, can try our best to talk this out with you today, answer some questions that we might remove a bit of stigma and fear around dying, and hopefully try to reframe it as actually maybe a normal part of living.
Yeah.
So after all of us will experience death at some point, and we don't really get a second chance to get it right. And that's why we do what we do every day. But if we can try and express the need to talk to each other about death and stop thinking that it has to be behind closed doors and that there's a taboo attached to it, then hopefully we can try and reduce some fear around it, and we may be able to see if we can even prepare for it and maybe even celebrate it. So it's a big topic. And so I'm really, really thankful that you're both here to talk to me about it, because it's not an easy one to try and talk about. So many people, Dorit, talk about prognosis. I think we should start there. So often people will ask, when given a diagnosis that we can't cure, palliative diagnosis, so how long have I got? Or people talk about being given 6 months to live or 12 months to live. And we hear that a lot in healthcare, but also in the media. So, Dorit, when it comes to dying, do we actually know how long somebody has to live?
So it's a good question. And I think there's a couple of different sides to that. Of course, we can't exactly narrow down the date of someone's death, especially not the day that they're getting the diagnosis. People go through different phases of their disease. And initially, even if they know that it's incurable, they might still have a lot of treatment options to prolong life and keep it pleasant at the same time. That's often the rougher phase to do prognoses in. And I think it's also where the variation in those prognoses is, and that's your typical, oh, they told me 6 months, but actually I lived for another 18.
Yeah.
It becomes a little clearer the sicker people get. There are signs that we professionals do identify. Nurses tend to be better at that than doctors.
Oh, very good.
Jeez. I'm very truthful. But there are different signs that we identify that things are coming closer. And initially, you're talking in very wide ranges of time, like years, months. And gradually, as the disease progresses and the patient gets sicker, we start seeing that maybe months or weeks, and then weeks and days. So we can narrow it down in that way. Good. And I think there's value in that as well, because if you know you've still probably got a long time, well, 18 months is not really long, we'll cut that out. But if you still know that you've got months to go, you're probably making different plans with your life with that time than if you think, well, actually, no, it's just weeks. So I better get all these things that are really important to me done. So while we get it wrong, I think there is value in doctors telling patients roughly what they think about time, because I think it helps patients plan and their families as well for whatever is left.
Absolutely, Dorit. I think I really agree, because what we're trying to say is that maybe not put a number on it, like 6 months or 8 months that we just kind of pull from the universe. But there is value in saying maybe months to a year, or maybe a year or a couple of years, that gives somebody that time frame to try and plan what they may want to do so we don't miss opportunities. And I guess that's why we're talking about this today, is that we don't miss opportunities to talk to our loved ones about dying. So thank you, Dorit. That was fantastic.
Yeah.
So something we do often see with people and families, and even in a lot of healthcare still, is that people can really struggle to recognise dying. And this means that potentially we miss out on the chance to say or do things before our loved ones are gone. And I've seen that worldwide. I've lost loved ones, especially who didn't really see what was happening. And so, Bruno, there are signs, like Dorit mentioned, that we can often see, and maybe we can share some of those with the people listening today about what may we see maybe in those last months of somebody's life.
Sure. Well, there's usually clear sign and patterns. In the last few months, usually people will get more tired, more fatigued. They will sleep more. Their appetite will decrease. Sometimes they probably won't feel like eating. They also often will want to start talking about death and dying, and with the family around them, maybe try to talk to them about the process and the logistics, about funeral arrangement and all that jazz as well. They just won't have the energy that they usually have, and often might become a little bit more kind of withdrawn from the rest of life activities.
Yeah, absolutely.
Yeah.
I think all of those things, Bruno, we sometimes maybe mistake for something else. And if we miss them, then we might miss out on the opportunity. One big thing that you said is about talking about dying. I think what we often see is that people try and protect each other. So I know many times we've seen loved ones that try and protect their family and vice versa. And what we see is them both crying separately about losing each other. And we try and bring them together to have those conversations.
Absolutely.
Until we start talking about dying, we can't do that. And
it's funny as well. It seems like the word dying and death have become rude words, so no one actually say that. So we say someone's passed away, and so on the unit we're probably more comfortable using that type of terminology. And sometimes people are a little bit shocked, but then I think once you cross that step and use those words and those terminologies, like, people are probably more comfortable around the process of dying and talking about it. Being comfortable with it.
Absolutely. Using the right one. People aren't confused as well, I think.
Absolutely.
Yeah. And you said a really great thing as well, Bruno, is that death is seen as a failure.
Yes. And I think in our society, we've been lucky enough with modern medicine that we live longer, we are healthier, but yet the one thing we know for sure, we all are going to die, and I think life and death are just two sides of the same process. And what we call life is really just the process of dying. So from the moment we're born, we say that we are living, but we truly are dying. And so if we can put that into context, if we can accept death before it comes, then we truly live our lives, I guess, in a meaningful way. And when death comes, there's probably less fear and less anxiety that comes with it.
Yeah. Which is important. We see that's really important. When we're thinking about maybe the final years, Bruno, so then if we can explain to people out there what that might look like, then we might be able to recognise a bit better. What does somebody maybe look like in the final days or short weeks?
There's something quite intuitive that comes with the last few days, and I think Dorit was very kind saying that nurses recognise those signs a bit better. I'm not so sure, but I think all of us are good at recognizing the sign. There's a feeling and there's an intuition that comes with it. But it's pattern recognition probably more so than anything else. But there are things like the person will be unconscious or sleeping. They definitely won't be eating or drinking simply because the body won't be able to process anything, and the body will be able to provide enough energy, whether by calories or by fluid, through just using its own reserve. And there might be secretions sometimes that can come and that can be quite confronting for the people around.
Yeah.
What else? The breathing pattern will change.
Yep.
And probably towards the last few hours, there will be a change in color most of the time. And a change of energy in the room.
Yeah.
That we can't really measure.
Absolutely. Yeah, it is tricky because we can't always measure. That's a really good phrase, Bruno. But those signs, I feel, might help people really recognise that is actually happening, and that we can then maybe ask questions if we see these things, even spanning over the months and the last few days that we spoke about. And what we try and do is then normalise that environment for people, something we feel quite strongly about. You know, I always say to people, death doesn't have to be done behind closed doors or behind closed curtains in the dark. For goodness sake, open the curtains, normalise the environment, let the sun in, and we don't...
Put some music on.
Get some music, but it doesn't have to be panpipes. I mean, look, I've told the whole of WA that I've taught about palliative care that if you stick some panpipes on for me in my final days, there's going to be some issues afterwards. I'll be back. So we do mouth care. So we've talked about a bit about eating, and we'll talk about that a bit more in a minute. But we do really good care. So we just take care of somebody in this final time, and we do some good mouth care. Yeah. Does that always have to be with water?
No, it doesn't. We've done that with gin, champagne, whatever, I guess, was important for that person. It might be someone who would love to have a gin and tonic or a glass of champagne with her or his friends. And so we can facilitate that so that person must still have, I guess, that taste and flavor around their mouth. And some other consciousness will still, I'm sure, register that flavor. And also it makes it it brings some humor around for the family and friends that are around, and it's okay to have a drink with the dying person there in the room and celebrate their life rather than making it all gloomy and sad. And
so we encourage laughter in the rooms. Maybe seeing on silly things that have happened in this person's life or adventures they've had.
We do. It's a big important part, isn't it? That people can relax and laugh and be around that person and surround them with love that just looks like everybody being there.
It's interesting as well. Often when we tell people what we do as a job, and they're all like, "Oh, it must be so hard. It must be so difficult." But it's actually there's a lot of humor and there's a lot of laughing and joy doing this work and being around death and dying.
Goodness.
We
are fit. That's why we've all been doing it for so many years.
Yeah.
So thank you, Bruno and Dorit. That was a fantastic answer. And I hope helpful for people listening. So from what Bruno has described brilliantly, Dorit, it does actually sound like lots of people potentially die in their sleep. And that's something that I find lots of people say to me is, "Oh, I really want to go in my sleep. I really want to die in my sleep." And so essentially, does that kind of fit, do you think, to give people a bit of reassurance that maybe a lot of what we see in that final few days is a little bit like dying in our sleep?
Again, it's not a straightforward answer, because I think if you really say dying in your sleep, it makes sleeping quite a scary experience.
Yeah, no, that's a good point.
But I think the reason people ask that question is because they're afraid of fighting at the end of life, or being in agony, or feeling short of breath is often a symptom they're very afraid of. And we do see most people actually die in very calm physical state. I just don't think it's sleep. I think it's beyond sleep.
Yeah.
And they get there through sleep, but at some point they're actually just unconscious.
Yeah.
So yes, they do. Most people die unconscious and unaware of their surroundings. Perhaps maybe they hear things, but it's so hard to test. But yeah, I don't call that dying in your sleep. I think that's a different process.
Yeah, thank you, Dorit, for explaining a bit about that. And it's interesting that you said about being unconscious. I believe, and I think Bruno might agree with me, but I know that over 15 plus years, I've seen different levels of that consciousness and the family being there. I remember one of our gentlemen who was very unconscious, and he was in bed, and I remember his wife, we had put two beds together so that they could sleep next to each other before the cuddle bed, and we pulled it apart, and she went, "Oh, I can get to you now." And she went up to him and she was kissing him all over the face, and she was like, "I'm going to kiss you all over the face and you can't do anything about it." And I could see him fully react to her. And we've had dogs come in and the person has fully reacted but being unconscious. It is one of the most beautiful things to see.
We've recently had a lady who really, really liked her church music, was absolutely unconscious, but with the music on was humming along. It's bizarre, but there's nothing else she was responding to. But it's lovely.
Yeah, we've seen the most incredible, bizarre things, haven't we? Yeah, it's just beautiful. So you mentioned briefly, Bruno, I did just want to touch on the fact that, lots of our families get really concerned about not eating and not drinking in those final days.
Yeah.
And we often find that families, because we show our love and we want people to get better, what we do is we want to, make food for them and get them to eat. But we know that our people that we're looking after aren't going to improve. And they get to the point where they're not eating and drinking.
Yeah.
People worry that they're starving and dehydrated. Can you explain a little bit?
Yeah, absolutely. I mean, it's such a cultural thing where we show our love through food. And so it's such a hard thing for people to truly realize. I guess the person dying, the body won't be able to process any food, but it might make the dying even worse as far as whether it's fluid or it's food. I think there was some studies done showing that each kilos of fat will turn into a liter of water, for example. And so we don't need to put up fluid, and we don't need to give any kind of water or wine. But food as well, the person won't be able to swallow, and so then you can cause an aspiration. Someone might get pneumonia and probably have a bit more of a complicated dying process. So I guess people just need to understand and realize that it's okay for the person who is dying not to eat and not to drink in the last few days, because the body will do without it very happily.
Absolutely. And we will explain to people what is normal. We see it all the time. Part of our job is to be there to explain, this is normal. This doesn't worry me. I'm here. I'll tell you if I'm worried. I'll tell you if it's not normal. So thank you for it.
And often the family will ask to put some IV fluid as well, because they can't swallow. But then obviously you just overwhelming the system, and so you're going to have fluid accumulating in the feet and in the hands. It won't be absorbed by the body. And again, it will make the dying process much more difficult for that person.
Absolutely. Thank you for touching on that, Bruno, because that's really important. Some families ask for that because they're so concerned, and we try and explain that actually we're going to make the person more uncomfortable than if we just let the body do its natural process, and then we're going to walk alongside them, and we're going to make them comfortable, and we're going to tell you what's happening. I think that's really important.
Yeah.
So, Dorit, one of our last questions, but a big one, is coming to you and face myself. So another common scenario that we see lots of families and even the people that we see get quite concerned about is things like using strong medications such as morphine. And so we can see that often people believe that this might hasten the dying process. So is that how morphine works, do you think? Does it hasten the dying process?
If we use morphine the way it's meant to be used for pain and for shortness of breath, and we use the right doses, then absolutely not. In fact, we know that comfortable people tend to live longer. But of course, if you give an overdose of anything, then it does work that way. It's a very common myth in death and dying, because we do use the strong medicines at the end of life because that's when the symptoms are worse. So you're not going to use morphine for a headache, but you will use morphine for cancer pain. The headache isn't going to kill you, but the cancer ultimately probably will. So death and morphine happen at the same time.
Absolutely.
But you're using morphine because of the dying process. You're not creating dying because of the morphine.
Yeah.
So it doesn't hasten the dying process.
No.
What I'm hearing, and we all know that, and something we feel quite strongly about getting that point across is that morphine is not a scary drug. It's got a very bad reputation for absolutely no reason. And we're only going to use it if there's a symptom for it to manage, such as pain or breathlessness, and that is it. We're never going to give it to somebody that doesn't have those symptoms, because we're actually not going to give them a very nice time. And again, we're not in the business of not giving people a nice time. We're there for comfort. And so it's really important that people will understand how we use those medications only if it's necessary. Yeah. Thank you, Dorit. And so this is a really good time for me to mention voluntary assisted dying. And so we often call it that. It is a legal care option throughout Australia. Essentially, the process in WA is that patients can discuss that with a healthcare professional. And if they're eligible, the patient can be given access to medications that does enable that person to legally choose the manner and the timing of their death. So the WA VAD statewide care navigation service is a good resource to support patients and families and carers out there if you'd like to learn more about the voluntary assisted dying process. The service is a nurse-led service and can provide further information and link people to helpful resources. So please get in touch if that's something that people wish to know more about. So we mentioned earlier, Bruno, we should probably wrap up, but I feel like we could talk all day. And that's the thing with us, isn't it? And palliative care, we love it so much that we really do want to get the word out there and hopefully get people to understand it much better.
Yeah.
So we get people saying, it must be really sad doing what you do every day. How do you do it? And I think it would be really, really nice to hear, Dorit, why do you do palliative care? Why is it something that you love doing?
Gosh, I know I had an answer to this before, but I think it's death and birth are the two real intimate moments of a patient's life. Obviously, at birth, you don't have a lot to say as the person being born.
Scream a bit, though.
Yeah, they do. That is so hard to understand. But at the end of life, people have had a lot of experience and have a voice that we can understand. And they're so very real in that time, very genuine. All the hush feathers have shed, and it's just the core person that's there. I like that. And I think it's a real privilege to be alongside that person in those intimate moments and to be able to address their deepest fears and support their families in one of their darkest times, even though death is a normal part of life. Yeah. It does make people sad, and it is the end of something. And to be able to support people through that, it gives me an energy, a warm, fuzzy feeling inside. Yeah.
Amazing, Dorit. That was the most beautiful answer. Thank you very much. Bruno, how about you? What makes you do what we do every day?
I think what Dorit says is really spot on. There's also a person who's trying to understand death and dying and its mechanism. There's something that happened, I think, on a consciousness level when you're exposed to death and dying on a daily basis, personally. And I think for most of us working in that specialty, you do look at life differently. You start sweating the small stuff, and it put everything into perspective, I think. And it's extremely valuable to be exposed to dying on a regular basis at least, and to be familiar with that process. And as Dorit said, it's such a privilege to be around people who are dying, their relatives, their friends, to try to guide them through the process, the grieving, the laughter, the tears, the sadness, all those emotions. Every time you come home, you feel like you've accomplished something very meaningful. And so you're ready to do it all over again next time.
Absolutely. Thank you, Bruno. That is an incredible answer, which I expected nothing less from both of you. I think you really did hit a good nail on the head. It makes us incredibly grateful. I feel like I really notice when people are walking their dog with their mobile phone in their hand, and I wish they wouldn't do that. I wish they would see the sky and look at the trees and hear the birds.
Flowers.
And we are reminded that life is so precious, and in an instant it can change. And if we lived every single day like it was our last one, I feel like I've stolen that from somewhere. But it's so true.
Yeah.
If we lived every day knowing that one day soon we'll be gone, and all our loved ones, then I think we would pay more attention. I really wish that's why more people were passionate about talking about death and dying. And I hope after today's episode, people will really have a think about talking to their loved ones about that. I know one of my favourite things about what I do is when I find that person in that incredibly special space in the last few days where they're unconscious. And there's nobody else there, and I can just sit with them in the quiet and in whatever that looks like. That's always been my favourite space to be. Thank you both so much for joining me today. You've been incredible. I never had any doubt.
Can I finish with this?
Of course you can, Bruno. Please.
At the beginning of my nursing in Palliative, there was this young man at the unit. He was in his 30s. He had a MD, and he came a week before admission just to have a look, make sure that was the right place for him to come and die. He was in a chair. He couldn't walk anymore. He was still verbal, able to speak, but he couldn't breathe without his CPAP, the machine that helps him breathe. And so we bumped into each other in the corridor. He was just having a look around. And then we looked at each other, and he removed his CPAP and had a few words. And he looked at me in the eye and said, there's only love in this life. That was it. And I was really I was quite shaken in a beautiful way. Anyway, he came back a week later to die. And one other friend, Joy, beautiful palliative care nurse, and indeed, and myself was there. We were looking after him. It was that last day, and he decided that's the day we're going to remove the CPAP and I'm going to die. And so his beautiful wife or partner was with him. Back then, there were still candles and incense in the room that was still allowed. And so there was a doctor and a nurse, and we removed the CPAP. He gave his wife a beautiful smile. They hugged. It was the most peaceful thing. And we gave him a last wash. His wife was involved. Doctor and nurse were there, gave him a bit of sedation just to make sure he was comfortable breathing without his CPAP. Removed the CPAP. This lovely man was incredibly comfortable, and he died a couple of hours later. But this story really stayed with me, and I think that really cemented why we do what we do. It was just a beautiful transition for him and his wife and all of us, really.
Thank you, Bruno. That's an incredibly special story for you to share with us there. And it takes a lot to share these things, because everybody that we see over all the years that we have been doing this, I feel, stay with us and really do hold a special place for all of us. And I hope that us talking today has really tried to normalise that process around death and dying. And I'm hoping that people will really take this opportunity to talk to each other about it, to start talking about it, to understand that death does not have to be done behind closed doors. We know it's a taboo subject and we know that it's a scary subject, but if we start talking about it, actually the less scary it'll become and the more normal. And that means that we can really start celebrating life and death.
Yes.
And planning for it. Yeah. So thank you both. If anybody's got any questions listening today, you can always contact the Palliative Care Consumer Line. If you're in WA, it's a great resource to ask questions. And this forms a series that we're doing on palliative care and all these fabulous people that are coming along with me who thankfully trust me in this crazy journey of this podcast. So thank you so much, Dorit, for joining me.
Thank you, Sarah.
Thank you,
Thank you,
Bruno.
Sarah.
Thank you both. You're incredible.